I can't think of a single program that the government does and does it well. And this scares the hell out of me.
It's no wonder many Americans are perplexed about a public option or confused by co-ops when even lawmakers struggle to explain them.
If it were a plan, it wouldn't be an option.
The public option, as proposed, would be run by the Department of Health and Human Services, which also oversees Medicare. With lower administrative costs, the government could offer lower insurance premiums than the private sector, giving uninsured Americans a more affordable option.
One version of a public option would be like the way the Medicare program is run today. It sets regulated prices, it's take it or leave it for the doctors, and it's big enough that the doctors, the hospitals, the healthcare providers generally have to take it.
But with Republicans universally opposed to a public plan,
the government really isn't a fair competitor.
Some centrist Democrats are seeking a middle ground, proposing regional or state health insurance cooperatives instead. The co-ops would be started with government seed money, but then turned over to the members themselves to manage. Because the co-ops would be not-for-profit, any money left over from members' annual payments would be reinvested, theoretically bringing costs down for everyone.
The co-op is, in a sense, sort of halfway there. It's part of the way there. It's not run by a private company, it's run by the community.
Back in the 1930s and 40s, hundreds of healthcare co-ops were established, but just a handful exist today, like the one run by Dr. David Orrs for 800 New York City restaurant workers.
Once they're out of the way, the for-profit private insurance companies like Oxford and Aetna, once they're not involved, the cost goes down by 80%.
The co-op idea is getting lawmakers' attention, but proponents of the public option argue that without the public option, these co-ops could never compete with private insurance the way the government could. Maggie?
Nancy Cordes in Washington. Thanks, Nancy.